For this week's Wellness Wednesday, we're joined by Dr. Rukayatu Ibrahim to talk about pediatrics. So can you just tell me, why should you get your kids back to school physical scheduled now?
Hello, thanks for having me. It's very important to get back to school physical scheduled right now. First of all, just to get that out of the way so that families can be ready for school, get their supplies when it's time to go to school. Also, a lot of kids have been home and they didn't do in class school, so they haven't actually had to get physicals for school. So there could be something going on that the families don't know. So if they get it scheduled, they can see their pediatrician who can find anything that is wrong with them and fix it before school starts.
Yeah, and do you guys see a lot of students coming in over the summer for those physicals?
Yes, usually most families they'll get the physical scheduled right now. They'll come in, we'll check them, make sure they're growing, get them up to date with their vaccines.
And then what does a back to school physical do for your child?
Well, at the back to school physicals, we make sure that the children are growing. We make sure that they are up to date on their vaccines. If the families have any questions or concerns about the children's behavior, both at home and at school, sometimes learning problems, ADHD, anxiety, we can talk about it. We can identify resources in the community for them and even in the school and help the families direct them to get the help they need for their child to succeed at school.
Yeah, and what are some things to ask your doctor at a back to school physical?
Yes, that's a very good question, actually. At the back to school physical, you want to ask the doctor whether your child is growing well, whether they're on track with their growth. You want to ask about their development, whether they're meeting all their milestones. You want to ask the doctor about any other questions you have about the health of your child. A lot of the time, we are able to pick up things that the families didn't even come in for. And then we are able to treat it or do labs if we need to and get the child healthy for school.
Yeah, and what are some things that a physician is looking for at these physicals?
Well, yes, as pediatricians at the physicals, we're trying to make sure that the children are growing. We want them to be safe and healthy mentally and physically. So we ask questions about anxiety, depression, learning problems. We also track their growth. We make sure they're up to date on their vaccines.
All right, that's some great information. Thank you so much for speaking with us today.
Thank you for having me.
Bye.